In a report recently released, the Africa Centers for Disease Control and Prevention says Mpox cases have risen by 160% on the continent in 2024 compared to the 2023 record. As of the 28th of July, a total of 14,250 cases and 456 deaths with a case fatality rate of 3.2% have been recorded in 10 African nations, including Nigeria. While Nigeria recorded 24 cases with no deaths, the Democratic Republic of Congo topped with 13,791 cases and 450 deaths. Here's a report.
The scars from Mpox are still visible on 7-year-old Grace Kabuo's face, as well as on the faces of a handful of other children. She lives near and plays in a camp for displaced people near Goma in the Democratic Republic of Congo. Grace has recovered, but her mother says she is still unsure how her daughter was infected earlier this month.
My daughter Grace had caught this skin lesion disease. I took her to the hospital where the doctors took good care of her and she recovered. And I don't know how or by whom my child had been contaminated. I just watched helplessly as the symptoms appeared on her body.
Grace had one of the first confirmed Mpox infections in the growing camps near Goma, where around 750,000 people have fled fighting between the M23 rebel group and the Congolese government. There have been 35 confirmed cases of Mpox in Goma since July 10, mainly among adults living in the displacement camps. The cases were caused by a new variant of Mpox that was first seen in a neighboring province, which seems to be better at transmitting between people than previous strains.
So children will be exposed, they will be affected. At the moment, they are few in number, but we wouldn't be surprised if that number grows. And children can also affect each other because of their close contact, playing together or sharing the same living quarters. So we do expect to see children, but we hope that those cases at least can be detected quickly and given the appropriate clinical care that they need to reduce pain and reduce the length of illness and avoid complications and long-term sequelae.
The cases are an escalation of an Mpox outbreak in Congo that has already seen around 27,000 cases and claimed more than 1,100 lives since the beginning of 2023. Mpox, a viral infection that spreads through close contact, is usually mild but can kill. It causes flu-like symptoms and pus-filled lesions on the body. Congo is facing 2 outbreaks simultaneously. There are no vaccines or specific treatments for Mpox available in Congo outside of clinical trials, although they are available in other countries. Experts say work is underway to investigate the new variant's transmissibility and severity. The risk to children posed by the new variant is still unclear, as it spread mainly among adults in neighboring South Kivu, where it was first found.
There are 2 vaccines for Mpox that have been approved by WHO-listed national regulatory authorities and which are recommended by WHO Strategic Advisory Group of Experts on Immunization, or SAGE. I have triggered the process for emergency use listing of both vaccines, which will accelerate vaccine access, particularly for lower-income countries, which have not yet issued their own national regulatory approval. Emergency use listing also enables partners, including Gavi and UNICEF, to procure vaccines for distribution.
Doctors say they have discharged 82 patients and not seen any deaths yet. They do not know for sure which variant is behind all of the cases in the camps, as they have only sequenced a handful of cases. It is likely that more cases may have gone undetected. Africa Bureau, WION World is One.
For all the latest news, download the WION app and subscribe to our YouTube channel.